Hi, how are you doing? Today we are going to try and explain something different today in our own video, which is composite sculpting. And speaking about sculpting, we have to just like try it and practice firstly in a tooth that nearly has a very minimum diameter, like premolar. Of course, upper 4 and 5 are just similar in comparison with their own counterparts, the molars, upper and lower. So, starting today with upper 4 or upper 5, as we all remember, in the first few years in dental school, they just teach you carving and also drawing. And from the drawing perspectives, specifically what drawing the occlusive surface of the upper 4, that our teachers, our tutors have told us to just draw two greater than symbols facing each other, toward each other. But the puckle one is just a bit rough with a very pointed and sharp apex, and the palatal one is just a bit semicircular, or maybe it's a little bit blunt. So the outline I use here in this video, an outdated composite, expired one, or maybe the one you use to just treat acrylic teeth. Um, you just like firstly draw the outline as I have described to greater than symbols. Then you just try to fill the area in between. How to fill it? By actually picking very small increments that you are able to just like take them out of the tube and just place them according to what you are seeing right now. Small increments actually just allow you to have a very successful restoration, because it's just minimize or reduce the polymerization shrinkage, and also just permit a very ease and very simple, seamless application process. As you know, that composite is very sticky, and when it's actually just very minute increment, it become a little bit easier and very readily, as you can see, because it doesn't stick, whether if you are just using a gold applicator or a metal one, an instrument. So you just like stack them up together, pushing them toward each other, as the all supplemental and developmental grooves that you are building are all just trying or aiming to get to the central axis of the tooth. Not accurately or sharp at the center, but they are like trying. As you can see here, I'm just like trying to slide or glide the composite toward the center. Every piece that I add, I try to push it toward the center. Uh, so also here, I am also trying to make the meso part equal to the distal part. So if you are just like trying to place composite on a real patient, so of course the dimensions are just very stable. But as you can see here, it's not very stable at all. The composite is still soft. I didn't want to cure it because my pips right now is still just to not to show that the composite is just beautiful because of finishing. So I'm just trying to make it all soft so I can alter and modify the anatomy. So I have just already told you that the increments is what actually is just going to make your own restriction very beautiful and prettier and very appealing to even your own patient. I know that we are basically talking about posterior teeth, but from a very academic perspective, the anatomy actually just gave you a lot of confidence that you were able to imitate the natural tooth structure appearance, the anatomy, the supplemental grooves. Even if there is like some bumps and some high spots, you are able to just completely remove them, and there will be also another developmental grooves not touched yet, which will give a very amazing appearance, as you can see here. Because even if all of them were high spots, so that just the vessels or the developmental grooves, the minute one, or even the shade that will be still exist, will give a very simple aesthetic appearance and will be very real and matching. Once you just start with premolar, just fix this process in your mind and just try to do it in home. I didn't use anything sophisticated or even elusive. You are able to just get a very hard object, like a plate like this. It's not actually a plate, it's a lid of the bear's box. And I have just taken it because it's just very smooth and clear, cleaned it, and then I started add the composite instead of printing templates. Thank you.